Greetings and welcome to Colorado Life-Changing Care and our Regenerative Medicine program. I'm Dr. Steve Tashiro. I'm a board-certified chiropractor and nutritionist with over 40 years of experience in the healthcare field, helping thousands of people overcome chronic health conditions. And I'm very excited to share with you information about our Regenerative Medicine program. This is proving to be an awesome means by which our ability to help people with chronic conditions has been tremendously enhanced. According to the National Institutes of Health, regenerative medicine is a process of creating living, functional tissue to repair or replace that which is diseased, damaged, or aging. The goal of regenerative medicine is simply to reduce pain and improve function by helping the body stimulate the repair of tissue that's damaged. This is done through the injection of non-drug, non-toxic, natural substances by our advanced practice registered nurse. Now, when we talk about regenerative medicine, we have a number of options to consider, and the goal of the evaluation is to determine which of these would be of most benefit to you, also at the least amount of cost. So we're going to talk about 4 different types of regenerative medicine therapy. I'll talk about the features and the benefits of each. Let's start by talking about dextroneural therapy. Dextroneural therapy is the injection of a sugar, dextrose, into cutaneous nerves. Cutaneous meaning these nerves come out to just below the surface of the skin. They also innervate deeper structures like joints and muscles. So when these nerves become entrapped by the tissues they pass through, whether that's fascia, muscle, or bony structures, they start becoming painful. And according to Dr. Harris, who has done a lot of work to develop the use of dextroneural therapy, he finds that 80% of his chronic pain patients are suffering from entrapment of these nerves. So in the treatment of these nerves, the dextrose is injected into the nerve. This is pretty much a painless procedure, and it causes the nerve to fire to discharge a signal. And over time, approximately 8 to 10 visits, the nerve eventually becomes freed of the area of entrapment, and that eliminates the pain. Great thing about dextroneural therapy injections is that they do not raise blood glucose levels. So for a person with diabetes, sugar regulation issues, that's not a concern. These syndromes where these nerves become entrapped are especially common in the head and face. So this has a lot of relevance to facial pain syndromes like trigeminal neuralgia, migraine headaches. They're very common in the upper and lower extremities. So if you have carpal tunnel syndrome or sciatica or piriformis syndrome or iliotibial band syndrome, quite likely these nerves are involved. Also along the spine and the back as well as the butt. So I'm going to show you a chart of the distribution of some of these nerves along the spine. And in the evaluation, we check these nerves for areas of tenderness, and if we find they're tender, those are the spots that are injected. So here's that diagram. Now, the next type of regenerative medicine therapy that I want to talk about is prolozone. Now, prolozone therapy involves the injection of procaine, which is an anesthetic, and B12, followed by ozone, which is O3. Now, the procaine opens the cells so the cells more readily take in the oxygen. The O3 is produced through what's called an ozonator. It's a machine that causes O2, which comes from a tank, oxygen tank, to be broken down into O plus O, then reassembled as O3. And when the O3 is injected primarily into joints like the knee, shoulder, spine, extremities, the ozone stimulates the activity of 3 different kinds of cells. Chondrocytes, which are cells that make new cartilage. Consequently, one effect of prolozone is to grow new cartilage. The ozone also stimulates the activity of osteoblasts. So those are the cells that stimulate bone growth. So this is relevant if there are areas of weakness of bone, recent fractures. And also the ozone stimulates osteoclasts. This is a type of cell that breaks down excessive calcium. So this is quite relevant if you have bone spurs or even stenosis. Not only that, but the prolozone decreases inflammation and pain and stimulates the repair of the tissue being targeted. Now, you don't hear much about prolozone in this country, although in Germany, where it originated, it's quite widely practiced. In German literature, there's over 3,000 medical references describing the safety and effectiveness of prolozone therapy, and rough estimates are that currently 30 to 40% of German physicians use this therapy. So that's prolozone, and I'm going to show you a picture with a before and after prolozone x-ray of the left knee. So in the first picture on the left, you'll see that the joint space is minimal, a little bit of space visible on the outside or the left. And then the x-ray on the right will show how much cartilage growth has occurred through a series of 8 prolozone injections. You'll be quite amazed to see there's clear visible space throughout the whole joint. So here's that x-ray picture. Now the next regenerative medicine therapy I want to talk about is platelet-rich plasma, or PRP. With platelet-rich plasma therapy, we first begin by removing a small quantity of blood from your body, and then we spin it down in a centrifuge. We concentrate the blood in a centrifuge, and this concentrates the part of the blood where the platelets are found. We then inject the platelet-rich portion of the blood back into your body. Typically, this is done into joints, for example, knee, shoulder, etc. And the platelets stimulate your body's own repair process by activating what are called growth factors. These are different kinds of cells that stimulate repair of tissue. This treatment is especially beneficial for soft tissue injuries such as ligaments and tendons. And of all the regenerative medicine therapies, this is the one you probably have heard most about. We hear often that high-profile professional athletes have used PRP in order to stimulate and hasten their repair from injury. Peyton Manning is one recent example. So that's platelet-rich plasma. And then finally, let's talk about umbilical cord progenitor cells. Now, of all the injection therapies, umbilical cord progenitor cells have the greatest healing potential. Now, these are cells that are donated by mothers of healthy C-section babies. They're donated to a tissue bank where they're then processed according to FDA safety guidelines, and then they are frozen. And when the umbilical cord cells are injected into your body, they activate a tremendous process of repair by stimulating your own stem cells, which then produce the effective repair. Stem cells, by the way, are the way that new tissue is made. Without stem cells, we would not live more than several hours. And that's why as we age, it takes longer to recover from injury because the activity and the number of stem cells greatly decreases. So that's the benefit of using stem cells from C-section babies. They come to us frozen in vials like this, which are then thawed and then injected into the area that's being treated. So umbilical cord progenitor cells are used for joints like knee, shoulder, spine, extremity joints, but they also can be used intravenously to help in the repair of conditions that are more systemic. The umbilical cord cells also are accompanied by collagen, hyaluronic acid, which is a lubricating fluid in joints, tissue scaffolding, which is the structure upon which new cells are laid in the repair process, and growth factors. Now, you've probably heard about stem cells by now because there's so much discussion about it on TV and in the media. And there are different kinds of stem cells. The one that is practiced quite widely is bone marrow stem cells. And in the use of bone marrow stem cells, these are extracted from your own bone and then re-injected back into your body in the area of need. Now, important consideration relative to bone marrow stem cells is that the older you are, the older and less plentiful your bone marrow stem cells are. And so that's why the older the patient, the lower the results are likely to be. And that again is the benefit of using umbilical cord cells because they have tremendous vitality and viability. It's like putting the cell vitality of a newborn into your own body to stimulate repair. Because of the tremendous savings compared to surgery, effectiveness, and also freedom from complications, regenerative medicine is indeed the healthcare of the future that's available right now. I want to show you an x-ray of my lower back. The x-ray was taken a couple weeks after I started developing chronic, everyday, low back stiffness and pain, kind of low grade, 2 to 3 out of 10. So I was stretching, exercising, getting adjusted, doing therapy, but the pain was persisting. So we took an x-ray of my lower back, and that's the one on the left that you'll see. And it shows that the disc, the cartilage between lumbar 5 and the tailbone, the sacrum, has been squashed, had been squashed. And there's also some narrowing of some of the other discs. So this x-ray was taken just a week or two before I went to a seminar on stem cell therapy. And at the seminar, I was injected into that same area, lumbar 5, sacrum area, with umbilical cord cells. The day after the injection, the stiffness and pain was gone. And we took this follow-up x-ray 4 weeks after the injection. And that's the x-ray on the right. And you can see there's been a significant visible, measurable improvement in the thickness of the lumbar 5 sacrum disc, as well as some of the other spaces. Having experienced that myself, I knew that I just had to bring this therapy into my practice to make it available to our patients. So here's that x-ray. An important question to consider and to ask is, well, that's tremendous healing potential there through these injection therapies, but is that enough? And the straight answer is no, it's not. Now, it should make sense that the healthier your body is, the better your body will respond to this kind of therapy. That is true. So in order to make sure that your body is in best position to benefit to the max degree from these therapies, we take our patients through what's called the 8 steps to wellness. And this is where we assess for and support inflammation in the body. We support the reduction of inflammation in the body. We want to establish structural integrity. This is alignment of joints, strength of muscles. We want to make sure that you're not overly exposed to electromagnetic fields, which are very detrimental to health. We want to balance your body chemistry, your endocrine system, your gut, your GI system, your immune system. We want to reduce allergies and sensitivities, make sure there's not excessive mental, emotional stress. We want to make sure that there are no metals and chemicals, especially in the joints that are being targeted with regenerative medicine, because they can prevent the repair of those structures. And we want to make sure the brain is being optimally supported. Once having done all of this, then a person is in best position to receive maximum benefit from these remarkable therapies. In the regenerative medicine assessment visit, I screen you for these 8 areas of function and then evaluate to determine which regenerative medicine therapy would be most beneficial. So that's done on the assessment visit. That's followed by what's called the report of findings visits, where I summarize my findings from visit 1 and map out some treatment recommendations to address the 8 areas, as well as the use of regenerative medicine therapy. The fee for these 2 visits is $125. But before even doing that visit, we encourage you to come in for a no-cost 15-minute consultation in which we'll just talk to determine if you're a good candidate to proceed to that first visit evaluation. So this no-cost consultation can be done in the office as well as by phone. So here's that phone number. It's 303-985-5540. Give us a call and set up that phone or in-office consultation, and we'll see if you're a good candidate to benefit from these services. So thanks for listening, and I look forward to meeting you and helping you to attain optimal health.